Sir, actually, it is an ever advancing field, and a lot of innovations is going on in this field, sir, I feel. And it is like just like general surgery, we have so many options, right from endoscopy to minimal invasive surgeries to open surgeries. So we can choose our passion towards what we want to do, and there is less emergency, sir. And obviously, as everyone know that it is a very gratifying field. So like patient satisfaction and our satisfaction is better, and it is one thing like I feel that it is not encroached by other. I had subscribed the app giving grand test in speed up. You know that you are competing with almost like 70-80% of whoever is preparing for that course. So for around 2 months I had used the app. I mainly at that time it was a short time of preparation, so I used to watch high yield topics, revision videos, and MCQ QBanks are like recalls and on tumor revision videos, AAU and EAU guidelines. That some 2-3 questions like it will be really helpful because sometimes they will give you confusing options. So based on guidelines, you can choose that this is the answer, this is what is given in the guidelines. So that was very helpful, sir.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Cyril Joseph, has taken a topmost rank of CML rank number 1, AML rank number 1 in the Super Speciality, the field of MCH Urology, in the session of INISS November 2023. Congratulations to you, Doctor, for having such a wonderful achievement.
So thanks a lot, sir. It's like a dream come true moment. Like I had watched so many interviews of toppers. Like I never knew that like I'll be like sitting amongst this interview and talking with you, sir. It's an honor to me.
It's a great pleasure to have you, Doctor. It's an honor
Thank
equally
you,
for me as well to sit with the topper and discuss your experiences.
Thank you, sir. Thank you, sir.
And can we know a brief background from where you started your career from and till date what all you have done?
Yes, sir. Sure, sir. Actually, I am originally from Pondicherry, sir. I have done my undergraduation from Jipmer Pondicherry from 2014 to 19. Following which, I have taken post-graduation MS General Surgery in AIIMS, New Delhi. So I have completed it 4-5 months back in July 2023. Following which, I was working as a senior resident in the Department of General Surgery. So now I have like given the exam, sir, for the second time. At that time, last time also I had given, but by close margin I couldn't qualify because last time told me that it was a little bit difficult paper. So this is my second attempt, sir, basically.
Last year, what
Yes, sir.
was the status of CML, or I mean, what was the status of the last year?
Sir, last year actually only 2 people qualified, sir, in urology. So I was short by 2 marks, basically 2 questions. I got 38 marks last.
Okay, so why urology? I mean, of all the specialties are available for MCH, why Dr. Cyril Joseph has interest towards urology?
Sir, actually, it is an ever advancing field, and a lot of innovations is going on in this field, I feel. And it is like just like general surgery, we have so many options, right from endoscopy to minimal invasive surgeries to open surgeries. So we can choose our passion towards what we want to do, and there is less emergency, sir. And obviously, as everyone know that it is a very gratifying field. So like patient satisfaction and our satisfaction is better, and it is one thing like I feel that it is not encroached by other departments, sir. Actually, everybody now wants to do some intervention in be it medical field or surgical field. So I think most of the things have been retained by the urologist. So I feel that we can choose what is our interest and then build upon it, sir. And it is also a combined department like medicine and surgery equally. So it will not be like only we are operating, like we will also have to medically manage the patient. So it is like a wholesome package that you get, and you are a super specialist also. So I wanted to do this, sir. And my inspiration has been my senior who has been working here. So he has guided me a lot. So he was my inspiration sort of thing.
Yeah, I mean, you rightly said, because most of the endoscopic and endourology and all these interventions, minimal interventions, are retained by urologist itself. Yes, where when we see the gastro, I mean, most of the endoscopic work gone to medical gastro. Similarly, when you see cardiothoracic also,
yes,
cardiology, a lot of stenting and all, TAVI, all this are gone to cardiology. Yes, as you rightly said, retained in urology, all those interventions, minimal invasive, and instant results also. I mean, you can send the patients home quickly. So great choice, and we wish you all the best for that. And can we know what was the methodology of preparation? What did you do to achieve this topmost rank?
Sir, I as per many of my seniors have told, they told me to start preparation during my second year when I'm relatively free, like from rotation, I'm back to the unit. I had subscribed the app, so I had started it during my MS last year in sixth semester when when there was a seat in Jipmer. So actually, I wanted to go back to my place when I had given the like when the seat had come. So I thought that I will give my effort. So for around 2 months, I had used the app. I mainly at that time it was a short time of preparation. So I used to watch high yield topics, revision videos, and MCQ QBank, sir, like recalls and this thing. And I used to note, sir. Like main thing was my notes. So I used to write my note and add whatever point is there in the recall session or QBank session. I used to have a note, sir. So basically, I had divided it into initially 70% of the time I used to study, then rest 30% of the days, like whatever is left around 1 week or 10 days, I used to revise the topic. So main key was revision and regularly giving tests, sir. So I had given like weekly, I used to give most of the subject test and subject weight test, like Campbell, like in the speed up, it is so exhaustively divided, like it is so compartmentalized. I think even after completing, like during the course of MCH also, I feel that app will be definitely useful for whoever is giving their final exam, because everything is given, most of the thing is given by line, and all the tables and all the flow charts is used. So at that time I had given, and but by as I told, by short some silly mistakes I couldn't qualify last time. So this time also I had around 2 3 months of preparation, sir. So same thing I had followed. My notes I used to revise, I used to give test, and I used to keep on like reading the weaker points which I felt was I'm not strong enough. So minimum 3 to 4 times I would have read my notes, sir. And regularly giving test and grand test, which obviously will know that how much competition is there. As you all know, like speed is since time immemorial, as far as I remember from my undergraduation days, like it has been a constant support for whoever is going to prepare for exams. So in giving grand test in speed up, you know that you are competing with almost like 70 80% of whoever is preparing for that course. So I just wanted to see where I am there, and by constant revision, my rank also used to improve. So it was like a positive feedback for me. So like main thing is like notes and extra points and revisions.
Doctor, how many questions did you attend this exam?
Sir, this exam actually I wanted to tell you. I had watched your video, sir. I think you had put one day before the exam, sir. So last time I had attended 78 questions, but by 2 marks, I missed it. That was little bit different exam, I feel, as far as the feedback given by my seniors. This time you had clearly told me that you attend 80 questions. It is a very small exam to leave the questions and come. So it is not like you are putting it blindly, because obviously you are prepared for the exam. You know, some like you have to make educated guesses. So I had made some educated guesses for around 5 to 10 questions, sir. I had attended 80 out of 80 questions. This
Oh.
time I was very sure that I will attend 80 questions, because I had kept 15 questions for review at the last time. But I thought about it, and then like one day before, you also told that in an supposedly standard paper or a normal paper, you have to attend 80 questions, and you have to make some educated guesses. Like you can't blindly like choose some option, but some educated guesses, some instinct, some gut feeling. You always used to tell that gut feeling, instinct is the right thing. And my mother also used to always tell me that if you put the answer first, you let it be it right or wrong, that we'll say it later. So I had attended 80 questions, sir. I am so happy that I attended 80 questions, because many of the guesses I have made retrospectively, I think that it is
All right.
like most of the things are right.
So your preparation for close to the exam was towards urology or for general surgery. How did you balance both?
I had been focused only on Central Institute, sir, because I didn't want to give exam for NEET SS, because I was not planning to join other colleges. And for INISS, we all know that 30 questions from general surgery, 50 questions it's from urology. So main weightage is on urology, because urology is a limited portion. So we can read, revise, and we can decrease the mistakes that we do in urology. But general surgery also you need, because that is a rank deciding factor. So if you are getting 20, 25 plus all the right answer in general surgery, you are in the top of the game. So for general surgery, I used to watch revision videos, sir, of integrated Sabiston and Bailey. And I main thing that they usually ask in INISS is general surgery, trauma, and breast endocrine for most of the part. Almost 75% of the part, I think it will be covered by this. But some basics of GA surgery also they ask. Some basics like cholecystitis or cholangitis or CBD exploration, that most of them, like most of us who have 3 years who have done residency, are familiar with. So I used to revise those topics mainly. So I had contributed around 1 week, sir, for general surgery, like 5 to 7 days only. Other thing, I was so focused on this time that I will not make any silly mistakes in whatever the questions I know, because last time I had made so many silly mistakes. So I was very like conscious on reducing those silly mistakes by revising even simple, clean, dirty, contaminated wound also. Like sometimes you go there and make mistakes. So that we used to avoid. General surgery, I had read for 5 to 7 days. Like 7 to 10 days we can read, but now time is there. I think like around 2 weeks we can read, sir, exclusively general surgery.
So you are giving general grant tests also. I mean, you are regularly used to give
Yes,
tests.
sir. And that obviously that grant test also used to help, sir, because many high yield points from critical care and trauma and general surgery, it is like a revision for us, and it is like we will also reduce our mistakes, sir,
Correct.
by putting as many MCQs as possible, so that we don't go and make silly mistakes in the exam and come.
Great, doctor. I mean, what is the message that you want to give for the future aspirants of MCH and MCH Urology?
Sir, future aspirants of, as far as MCH Urology is concerned and INISS exam is concerned, I can give, sir. The primary support has been my mother, who was with me during the course of my preparation. As I'm in Delhi, she used to take leave and come. So, main thing is you should have a very supportive group, sir. Supportive group of my mother was there, my senior was there, my colleagues who had helped me to cover duties and who had been a constant support of encouragement, sir. So, whenever a parent is encouraging that, as we all know that entrance examination is a very stressful time for both mentally, physically, and whoever is there with us. So we need a good support system, sir. And second, very most important, I have told all my juniors is we should have the mindset. Even wherever you have done your UG or PG from, it doesn't matter. If I can do it, why not others? That's what I have told everybody of them. You have to have the mindset that you have to write INISS. You should not restrict yourself only to NEET SS, because many of them feel that it is out of their box, out of, I don't know. And I have already told them that I'm trying to tell is, you should have the mindset, sir, for example, that we will able to achieve it, but you need some strategy, you need some smart work. So that second, we should have mindset, sir. Third thing is you should you should revise, read and revise. Without revision, reading is it is useless, I feel, sir. So basically read and revise, and weekly one test, subject, grant test, whatever be it, you constantly be in support of MCQs, because being in support of MCQs, you are at spinal level, at instinct level, you used to work, you will give the exam. So you will, that will reduce your silly mistakes, one, and that will help you in giving educated guesses. That is very important, because some option we would have seen in some other question, so they would have asked us in this question. So subconsciously we sometimes eliminate the option, and that's also I have told 4 5 points.
Now, what is your experiences with speed and speed faculty of especially Dr. Farooq? And
Yes, sir. Actually, as I had already told, they have compartmentalized the app so much, and it is very easy to scroll through the things. And urology, especially Farooq sir, Ramkrishnan sir, who had been putting constant updates on tumor revision videos, AAU and EAU guidelines. That some in 2 3 questions, it will be really helpful, because sometimes they will give you confusing options. So based on guidelines, you can choose that this is the answer, this is what is given in the guidelines. So that was very helpful, sir. And many tables and figures that I think Anand Balaji sir, I think is video, and that part is there. And notes is also, it is line by line from Campbell, because as I actually for preparation I wanted to read Campbell. My seniors had told some part at least you read from Campbell, but it is a very huge book. It is a 3 volume book, and it is if you can read from your iPad or phone, from an app with notes and highlighted points. So I felt that it was easier. So it made my revision easier. It made my understanding easier. I used to it has become very handy, sir. During the COVID time, many apps have come, so it is a blessing in disguise. As that's what I feel. All the this speed app especially, because and the main thing is because of the division that was given in the speed app compartmentalized. I used to write the topics in the board, and I used to divide the days. Within 3 days, I will finish this. This 3 days, I will finish this. So for timetable also, it was very helpful. I think there are more than 160 chapters in Campbell. So I used to divide in the app. It is divided more concisely, so that I used to write only the main topic. For example, lower urinary tract dysfunction, neurogenic bladder, like that. So it was it helped me in various phases of the profession, sir.
Great, doctor. Now, time to thank whom all you want to thank. You can use this platform
Okay,
to
sir.
thank them. They have built your career from day one till date. I've been with you.
Okay, sir.
How you built like
Thanks,
this.
thanks a lot for giving this like this slot, sir. First of all, I would like to thank my mother and my brother, sir, who had been constant support from me since like the time immemorial, as I can remember. I studied in Kendriya Vidyalaya, sir, which is there in the Jipmer campus. So after school, I used to go and be in Jipmer. Like my mother is working there, so I used to go be there in Jipmer environment only.
So, mother is working in Jipmer?
Yes, sir. She's a head nurse, sir, staff nurse. So we used to like I after school I used to be there. So like that made I don't know, maybe subconsciously I always wanted to become a doctor.
Native of proper Pondicherry.
Yes, sir. Yes, sir.
Okay. So from
So
school, from which Kendriya Vidyalaya you studied from when from
KV one
one
first standard. Yes,
first
sir.
to 12th.
Yes, sir.
So you are in Jipmer for school and also for your medical.
Sir, I was born there only, like in Jipmer.
Wow. I think
Sir,
Jipmer should
born and brought up in Jipmer.
So I think Jipmer should celebrate this.
Sir, definitely, sir. I have told my consultant, surgery consultant, that Dr. Sudarshan, sir, who was very instrumental. Like he helped me. Like at PG time, I was having a confusion, sir, to join Jipmer or AIMS or PGI. So at that time, he had been very motivating for me, Dr. Sudarshan, sir, who told me that you go out of Jipmer once, you see the environment outside, you see what is the system outside. So because of him only, more than 70% I had come to AIMS New Delhi, sir. Even my parents were little hesitant because I am going out of the home for the first time. So I had come to AIMS New Delhi. Now I will be mostly taking it here only.
Delhi.
MCH Urology. And my senior sir, Dr. Kevin sir, who used to give me constant updates of the department, what is going on. Some cases he will show, like we used to be like buddies. Like he used to share cases. Simply we'll be talking like everything, sir. And my colleagues, Dr. Ansa, Dr. Ankit, Dr. Ram, and many seniors here, sir, especially Gopal sir, Suneha ma'am, Kanika ma'am, my batchmate Neelam. Everybody has been so much supportive, sir. Like I miss them so much. Like I have called them here to join and this thing. So we are expect to have a reunion here. So like and all my friends and well wishers who had been constantly telling that don't worry. After exam, I was really stressed, sir, because it was a very highly competitive paper and it will be a high scoring paper. So I thought that okay, like what if I'm out of the game? And as I told, I watched your YouTube channel also, sir. How to prepare for INISS 2024 also. I was watching and I was telling my batchmate. Then after 2 days, results have come. And I would like to thank all my like faculties who had helped me with the preparation from throughout the time, sir. Especially Speed Up, Dr. Farooq, sir, Dr. Ramakrishnan, sir. And your videos have been motivating, and I have watched all of your videos, sir. Like especially in YouTube, whichever I have subscribed YouTube that channel, I used to watch everything. Like for the past, I think 1 year, I have watched almost all of the motivating videos that you had put, sir. Even for NEET SS, I was simply sitting and watching. Even though I was not giving, but I was like some days you feel really low, but you want some motivation from somewhere. So at that time, I used to always watch, and it was very like great
Thank,
experience
thank you.
throughout, sir. I am very
Thank
happy
you very
that
much.
I'm going to the next phase of
Next phase of life.
Academically, sir.
So from where you started your career till where you have achieved is, I mean, tremendous. It looks great. The kind of things that you have worked out one by one, and you have put your mother, a very very proud mother today. I mean,
Sir,
that's the, I
definitely,
mean,
sir.
the entire
Sir, I am
interview, my
very
conclusion.
yes, sir.
I have taken so many interviews. I would have taken thousands and thousands of interviews. The
Yes,
only
sir. Yes,
purpose
sir.
of doing it is to understand what a topper undergoes, so that when you watch when I do something, it is nothing but the experiences of those toppers.
Yes, sir. Yes, sir.
And
Definitely, sir. I had watched so many videos.
so the conclusion of this thing is how a son can make his mother happy, proud, and head up, and see kind what a parent wanted, and you have given, and you are such a
So definitely, sir. She has been now so much support. I can't thank her enough.
you have done great, and she'll be definitely a happy mother. Convey
Thank you,
our
sir.
regards to her as well.
Sure, sir.
And,
Sure, sir. I will
and,
convey your regards.
and to all people around you and your friends and relatives.
Definitely, sir.
So I think almost we're coming to an end of this session and interview. And once again, we wish you all the best and all the success for a great career in urology in making. And in years to come, you'll be keep inspiring us like this always. And
Sir,
for
definitely,
that,
sir. Sir, actually, you have been all my inspiration to me. I don't think like I can guide my juniors. I can't be.
you
I
can,
don't know. I can be an inspiration or not,
yeah,
but I have got inspiration from others only.
you are inspiration today. You are inspiration today, and definitely you will keep inspiring them throughout.
Thank you.
And for
Thank
that,
you, sir.
yeah, for that, we wish you all the best and all the success to have a great career in urology. All the best.
Thank you so much, sir. Thank you so much.
Thank you, doctor. Take care.
Thank you.